Multiple myeloma is a blood cancer that people get. It is more common in elderly people, and because it is a blood cancer, it affects one's blood cells. It affects white blood cells. It affects both the T cells and the B cells, which are responsible for the immunity we get from vaccines as well as natural immunity. So multiple myeloma is one of the many cancers that put people at high risk for bad outcomes should they contract COVID, whether they're vaccinated or not. Yes, it certainly is possible, very possible, that if Colin Powell had received the third dose of vaccine, that third dose may have triggered enough of an antibody response such that he would have been in a better place, better able to fight off the COVID infection. It's really thought that with each subsequent vaccination in the series, you have an increased chance of producing more antibodies such that you might get protection. It's even recommended for some people who are significantly immune compromised that they go ahead and get a fourth dose of COVID vaccine 30 days after the third dose if they're thought to be significantly immune compromised or have their blood checked and find out they have zero or low antibody levels. And so for Colin Powell, if he had been able to get the third dose 2 weeks or so before he contracted COVID, it might have certainly saved his life. I don't think we have specific statistics about what percentage of our fully vaccinated hospitalized patients are significantly immune compromised. I haven't seen that kind of an analysis done. But what we do know is that if you are unvaccinated, you have about a 10 or 11 greater chance of dying from COVID, also about a 6-fold increase chance of contracting COVID if you're exposed to it. I do know that the vast majority, more than 90% of our admitted patients are unvaccinated, and almost all of our patients in ICU and on ventilators are unvaccinated.
So there's nothing in particular, any kind of particular immunocompromised condition that makes you more vulnerable?
Yes, so
I'm sorry, go ahead.
Sure, so there's a variety of different immune compromised conditions. If you have many types of cancer, that can suppress your immune system, especially if you're on cancer fighting medications that are made to basically fight the cancer, which as a byproduct suppresses your immune system. There's also a number of people who have different kinds of autoimmune diseases that are on medications that suppress immune systems that are at risk. So there are a fair number of people. I think it's thought that 3 to 4% of Americans, so between 10 and 15 million Americans, are potentially significantly immune compromised, such that if they get COVID, they're at much greater risk for severe course, possibly death.